Good afternoon, everybody. Welcome to the Facebook Live here from the Health Department today. My name is Justin Westmiller. I'm the Director for Homeland Security and Emergency Management here in St. Clair County. And we've got...
And I am Dr. Annette Mercatante, the Medical Director and Health Officer of St. Clair County. So welcome.
We're happy to come to you live on Facebook today to give you an update on the COVID-19 response here in the county. And I think what we're going to do is give you a quick update on where we are in the county and then take a few questions. First, we obviously have been having a pretty good week with the response. Our case load has not gone up very significantly. We've only gone up, what, less than 10 cases, I think, all week, right? Is that
2 cases since the last update?
Yep.
We have been at a very slow, steady new caseload for a couple of weeks now.
Yeah.
We haven't gone to zero. We see new cases every day. We're seeing hospitalizations, new admissions almost every day, but not a lot. We are certainly not in an acceleration phase. We have, in fact, flattened the curve. So success on that front.
Yeah, it's really been pretty good news.
Not without a cost, though.
That's right.
And we understand that the cost is taking, the toll it's taking on all of you and all of us as well, not being able to live your lives the way we normally do. But the good news is it does appear to be working. So let's hover over that positive note for a while.
Yeah, and we know that just a few minutes ago the governor did extend the stay-at-home order, and we know that that's going to have some really, really significant impacts to the residents of St. Clair County, and that is not lost on any of us. And we have not really had an opportunity to take a look at what a lot of that order has. We just got that same info just as much as you did. So the EOC and the Health Department are going to take a long look at what that order has to say and have more to say about that in the coming days. But what we're here to talk about today is really what some of the data behind us has to say.
Answer your questions.
And answer your questions.
Try and find out what's on your mind.
That's right.
Why we want to do Facebook Live, because we want you to share with us what's concerning you most.
That's right.
So we can respond. So, Jennifer, should I just go ahead with some of the questions we have earlier? So a big question is always about data, and we have recently had some discussions and concerns about the way we report death data and the way we report hospitalization data. And one of the questions was how many patient deaths are out of county residents, and I've heard people were being transferred or coming here from the hardest hit counties. So that's kind of a convoluted question. Overall, we only count deaths that are COVID-related, COVID-confirmed. In fact, COVID-confirmed is by far what we look for before we claim it as a COVID death. And they have to be a resident of our county. So there are no deaths in our count that come from other places. It's that. There are no hospitalizations that are not our residents. Our residents are counted whether they're hospitalized here in our 3 hospitals or if they're hospitalized in another place. If they're our residents and they're hospitalized, we count them as hospitalized patients. Now, what happens when somebody is transferred here, for instance, when there was a lot of surging going on in southeastern Michigan and the hospitals were being overloaded? Those patients were, in fact, brought here. I think our last evaluation was a total of 38, I believe. 38 people were at one point transferred to all three of our different hospital systems. And in the last several weeks, I might add that nobody has been transferred in. Those 38 people have never been counted in our data for hospitalizations, never. That is an internal hospital decision. They were brought here because capacity, they were able to do it, and at no point was our hospital capacity compromised or our ventilator support compromised. Because we look at that every day. We look at our system every single day to make sure that we have ample hospital beds and ample ventilator support. So even during the time where we were assisting our fellow hospitals and our fellow counties, that was not a risk to us. Nor was it the reason COVID got here. COVID had already been here. We've already had COVID cases at that point. So it wasn't a matter of being contaminated by someone else. Now, transfers into our community, maybe from a nursing home. That has also caused some concern and confusion. And I'll just go on record to say that I may have been responsible for some of that confusion, for some of the comments, because it's complicated and sometimes the explanations aren't as clear as they should be. We count nursing home residents the same as any resident. If you live here in our community, you're our resident. If you move to a nursing home, here, the day you move into that nursing home, you're our resident. So if you get sick with COVID, you're part of our total COVID case. But we understand that if you've been in a nursing home, say in Macomb County, and then transferred here with COVID, that really shouldn't count for our case because you got infected somewhere else. So we use this 14-day rule, and it's not a rule, it's a guideline that our staff, our communicable disease nurses use when they investigate a case and try to determine if we should count that case in our load or not. And so if a person was infected when they came here, they are a resident, but they are not counted as a COVID case, okay? If they've come here just because they have been discharged from a hospital or they fell and they needed to be in a nursing home and they were in the nursing home for at least 14 days and then got diagnosed with COVID, then they are our case. These cases are never counted twice. So if you're a COVID case from one county, that's where you're going to stay. Unless we find that there's a problem, then we move it. So it comes from one place to the other, but it leaves the other. So cases are not counted twice to the best of our abilities. And of course, none of this is perfect, and the rules have changed, and the definitions have changed, and they're probably going to change some more. So numbers are never absolutely accurate. When we give you these daily numbers, sometimes the following day, people have been moved around or are switched to different places, and so the numbers change. And so that's always been a source of confusion, but as long as we give you daily numbers, there's going to be those slight discrepancies. So we'll talk about maybe hospitalization data later that might come up. What do you have a question, Justin?
I do. So again, I have a couple of questions just like Dr. Mercatante did. So one of the questions that I received was, now that more local businesses are opening up, face coverings or masks are required. Where do I go to get a non-medical face mask? So more and more you see these cloth masks coming up, and there are many businesses around St. Clair County and even out of the county that are offering masks either for free because they're being generated by volunteers and things like that, or they're being sold at a very minimal price. We have on our website, bereadystclaircounty.org, you can find a listing. So we suggest that you go there and you can find a very good list of opportunities to get cloth masks. So I urge all of you to go to our website and you can find a really good opportunity for masks there.
I've also seen some great templates on YouTube and video where you can just take the bottom of a t-shirt and cut it out, and really simple things. So I'd urge you, if you're handy and you have some extra t-shirts at home, you can certainly do that as well.
Absolutely.
Yeah. So the idea is not to have hospital grade medical. We all know that these masks are not ideally suited to prevent all germs from coming in and out. It's just an added protection so that if I sneeze, it doesn't go all the way over to there. It maybe goes to here. So it's just an added precaution, but it's helpful to your fellow citizens and your neighbors. They feel safer when you have a mask on. It goes a long way towards showing your neighborliness and your care for other human beings.
And you can also use handkerchiefs and things like that too, right?
Bandanas?
Yeah. So.
Okay. So one of the questions is, can we have a map of total cases in the cities and still have a map of active cases in the cities? And this idea of where the cases are is constantly a concern. I understand it, and we do our best. I don't think we have that map up right now, but yes, Vanna, I'm sorry. We need our map turner.
Is it?
But I do want to say.
Yeah, it's no, it's on the back side of it.
That's not that one. But I do want to say this about case counts.
There we go.
Here we go. So this is what we've been putting out. And the reason we do it by larger townships is because we want to respect people's personal information. If we narrow this down to a small area and we report one person having COVID, that area can oftentimes figure out who that person is. And we're just trying to keep this so that your personal information, if you do get infected, is not something that the entire county can see. Right. Now, it is a work in progress, and we understand your desire to know, so we've tried to do it this way so that you can see this larger area. It's a little harder to identify, but that is one of the reasons we haven't really pinpointed cases in a small geographical spot. It really is just to protect people's privacy. In general, it still gives you the information you need to know that there are cases throughout the county, and the areas that have the most density of people, the most heavily populated areas, have the most cases. When you look at rates per population, there really isn't any area in the county that has a higher case rate per population than another. There's no real hot spots where you're more likely to get infected. You're more likely to get exposed to the virus when you're close to other people. Okay?
So my next question is, I saw the Yale Bologna Fest was canceled yesterday. Do you think that we will see more summer events canceled? And the simple answer is yes, I do believe that we will see many, many more events canceled. But as much as that is distressing and unfortunate, what I want to focus on is how many really wonderful things we can still do in St. Clair County. We have this wonderful blue water area, with all of our waterfront community area. Down in the south end of the county, we have wonderful waterfront area. Out on the west side of the county, we have really wonderful things to do. And so, get out, visit the parks. Now, you may not be able to play on the playground areas of those parks, but there's wonderful trails that you can do. Get out and ride those bikes, use those rollerblades. Do all those outdoor things that you can still do this summer. Obviously, Doc, we need to socially distance, right? We need to do those personally protective things that we need to do because of this virus, but still get outdoors and do the things that are still available to you. Don't just lock yourself in your house. Please enjoy yourself as much as possible this summer, even though we have to kind of manage our situation a little bit.
And do use those apps in your phones.
Yes.
And let's utilize the technology that we're blessed with. Can you imagine back in 1918 when this was happening and people really had no ways of communicating with each other? And we do. We can reach out and talk to each other. There's some wonderful apps going on. What's the one I saw the other day? Headspace. Please check our website frequently and look at some of those recommendations, because there's some really great stuff that you can do, and you can do it with other people just remotely. In a way, we've got to get used to this. It's not the same, but I've noticed that I've been doing a lot of these remote meetings, and the first couple were really awkward, and everybody was talking over each other and saying things at the same time. And now 2 months later,
right,
we're actually a lot better at it, and these meetings flow much more naturally and are very productive again. So I do think there's a learning curve with this. Help those people who aren't really tech savvy, like myself, your grandparents maybe. Help them out. Get them online, if you will, so they can participate as well. It'll do everybody a lot of good.
What is the number one thing we've learned in our last 8 weeks of doing conference calls? Use the mute button, right?
Use the mute button.
That's right.
Always put the mute button on, especially if you don't want to hear all these people hear your side conversations.
That's right.
Horrible noise. Yeah. So it's gonna be. We know it's gonna be a hard summer. It's gonna be a different summer.
Yeah.
And so let's try and find those positives. There's some wonderful things going on. These gratefulness movements, and we just have to do this work. We have to do it, and we have to do it together.
And again, we understand none of this is easy, but it's going to take a village, right? And so you all have to be part of our village, and we appreciate every single one of you. So, Doc, I think you're up.
How many tests are being done in a day? So we all know and have heard, both from our federal government and our state government, that testing is the key to reopening. And in many cases it is. It's not just about testing. It's about testing and what we can do about it. But we got to get the testing there piece first. In St. Clair County, we're doing about 50 tests a day. We're doing better and better every week. We measure that on a weekly basis, and I think we put that number out. Anthony, are we putting that out on Fridays? On Fridays, we're putting out our weekly testing capacity as well as the percentage of positive tests. And we are definitely doing better with that as well. What's our goal? Probably 10 times that much. The state's goal is somewhere between 15 and 30,000 tests per day. And that ratio for us is about 400 tests a day. So, we're going to keep getting there. We're going to keep pushing it. And then along with the testing, we have to have a system of response that's meaningful. It's one thing to test somebody, but what good does it do if you don't do anything about it, right? So we do need both of those components. And I'm optimistic that by the time we're ready and the state's ready, we'll be ready as well.
All right. Another question that I received was, I see some people are not wearing masks when I go out. Shouldn't everyone be wearing a mask? Well, that seems like a simple answer, but it's not necessarily a simple answer. So the best answer I have for you is, it's been recommended that if you can wear a mask and you feel comfortable doing so, then yes, go ahead and wear a mask, because like Dr. Mercatante said a few minutes ago, wearing a mask just protects others from what you may have and you don't even know it. But there are many times where it may not be appropriate for you to wear a mask, such as you have a condition like asthma or COPD or something that keeps you from safely wearing a mask, and that we all understand that. So it's obviously a personal preference, right? But just understand that you wearing a mask makes other people around you feel comfortable, and you do have the opportunity to protect others around you by wearing that mask. Again, you've been requested by the governor to wear it, and doing so does potentially protect others around you. It
is a sign of kindness, and it's a sign of caring. And so if for some reason you can't wear a mask, there's a couple things you might consider, i.e. social distance. Don't get close to people. If you can't wear a mask, don't get within 6 feet of them if you can help it. Yep. And the other thing is, if you're in a place where somebody else isn't wearing a mask, don't get mad. Keep your distance. Yeah. Walk away. You can maybe offer them a mask, but they may not appreciate that. So my suggestion is just let it go, but keep your distance so that you don't get inadvertently exposed and then you're worrying about it, for the rest of the time. So it's kind of a live and let live approach, but in some respects it will keep the peace. But I just urge all of you that if you have a mask and you can wear it, I keep mine around here, and I'm up and down because you can't talk with a mask very well. You can't eat. How do you drink with a mask on, right? So I keep it near me, and then I pop it up whenever I can, just to kind of remember that that's the right thing to do. Do we have any other questions, Jennifer?
Could you talk about testing plans in long-term care facilities?
So the testing plans in long-term care facilities has been a priority, and that's because they are one of our more vulnerable populations. They don't really have an option of getting up and moving 6 feet away. There's in these buildings where people have to constantly come in and take care of them. We understand that. So there are two methods to this approach. One is to fully understand what each one of our facilities needs. Do they need PPE? Do they have the space to put COVID positive residents in? Are their staff well prepared? There's just a whole variety of things. And those questions and surveys are being done in a variety of ways. It's been a little chaotic, quite honestly, because everybody's kind of getting into the mix and doing this. But that is our first step. And I believe St. Clair County, we're doing a good job communicating with these places and trying to figure out what they need and providing them and what they need. The second piece is to going in and testing everyone, whether they're sick or not sick. And what that allows you to do is find those people that may not be showing symptoms and move them as well. We call it cohorting, move them as well to the COVID wing so that they don't continue to shed and get other people infected. It's a method that we think is going to be fairly successful, and we're engaged in that process right now. And we're going to continue to work on that diligently over the next several weeks and probably repeat it again after that. I think this is going to be an ongoing piece of development work.
Could you talk about antibody testing? That has been a very popular topic.
Antibody testing is very popular and very confusing. Very confusing. We're not there yet, people. Antibody testing, without a doubt, is going to be a helpful tool. Testing in general is a good tool, and there are going to be multiple ways of doing testing. But right now, antibody testing is still not readily available. And more importantly, it is not always the most reliable. It depends on the test and the manufacturer and how it's done. And so what we don't know about antibodies, we don't know when exactly people mount an antibody response, whether it's 3 weeks or 6 weeks or 8 weeks. We don't have any real solid. And probably more important than that, we don't know whether the antibodies mean that you're immune or how long you can be immune. So as much as we'd like to say that if you've had COVID and you have an antibody and therefore you can move around the community without concern, we really can't say that. So right now it's being used as a tool to try and understand how much of the infection is in our community, and maybe we don't know it. And so it's being used, but be careful with it. If you have an antibody test, it's very difficult to say to yourself, well, now I don't have to worry. We don't want you to do that yet.
So I have a question that I'd like to follow up on here. And it's very, very good news, actually. So what is the latest flooding update? And we're shifting gears a little bit. We actually got some really good news from the Army Corps of Engineers just the other day on the May 2020 update. And it looks like all of the data is showing that the flooding may be easing up a little bit, and the summer may be a little less on the flooding front than was predicted. And so we may have gotten a little bit of a win. We're going to be a little skeptical, but we may be able to ease back a little bit on some of our flooding planning, and the residents. We're gonna take a little bit.
Not two disasters at the same time.
That's right.
That's great.
We're gonna smile a little and be thankful for that a little bit. And some of our residents in the waterfront communities can take a breath and be thankful for that a little bit. Obviously, we're going to keep a close eye on all that data, but it looks like we may have slid by on that one. So we're still going to have some high water, but it's not going to be devastatingly high. So we're very, very happy about that. So we'll keep an eye on it, and more to follow.
How many hospital beds in the county do you base your data on?
Oh, that's a really good question.
That is a
The
good
question is, how many hospital beds do we base our data on? As you know, we've generally been reporting total hospitalizations, and then the percent of beds that are available and the percent of beds that are taken up by COVID. And the reason we do it that way is because the total number of hospital beds changes. It changes by staffing. So if staffing is limited, you have to have a certain ratio between staff and patients and beds. The beds can change considerably by capacity need. So as we were planning and anticipating a surge, all of our hospitals had plans where they could rapidly increase the number of beds by taking a single room, for instance, and making it into a double room, or converting other areas into patient spaces. So it's a variable number, and it changes. Justin just looked it up. We are able to look it up every single day. The hospitals report what their bed capacity is, and today the bed capacity is 305, but I can tell you it has been many other numbers since then, which is why just having a number of how many people are in the hospital isn't really telling you what you need to know and what we all need to know, which is how is that number impacting our hospital's ability to take care of all of us, regardless if we're COVID or not. And so that number is available, but it changes from day to day.
Right.
About 300. And about 40 ventilators. But we started out like with 30 ventilators, and I think we got up to 40. And now we're at 50 ventilators.
Yep.
So that changes too based on resources coming in and resources going out. So, and as I mentioned earlier, we never got close to using all those ventilators, so that's good.
There's another question about hospitals. A question came about, are all hospitals treating COVID patients or only certain ones?
All of our
All of ours,
hospitals
yeah.
are treating COVID patients. It is part of taking care of people. Now, our hospitals have different levels of capacity when it comes to trauma, when it comes to stroke, but when it comes to infections, all hospitals take care of these things, and all hospitals in this situation are expected to keep COVID patients all the way. So transfers out are really not an option unless our capacity is maxed. So, you know, if you get a certain infection, you're not going to be automatically shipped anywhere else. You're going to be at the facility that you presented to. And you're going to get good care at all those facilities too.
Yeah, this was a very different situation than a normal medical situation like every other time that we normally operate. Yeah.
Okay, another question. This person wanted to know specifically about from 10 cases to 7. How can you explain that?
Oh.
Okay. So Anthony can probably give me a little bit better data because he's our data guy that moves people in and out. But typically people can be moved in and out of a system for a couple of reasons. Sometimes they're put in our system under probable. That means that they present as COVID symptoms. They were perhaps a family member that was in a house with a COVID confirmed person. They get their tests, and if their tests come back negative, we take them out. Okay? So there are clinical ways of defining COVID, and then there's the state reporting system. And if you get a COVID test and it's negative, you are no longer a COVID counted case in the state counting system. Your doctors and hospitals may continue to treat you as COVID, et cetera, So that's one reason. Another reason may have been investigated and the person didn't live there. What would be other reasons that would be moved? Maybe it was a duplicate case. Sometimes duplicates show up, and when we go into the system, when we investigate those cases, we realize it's the same person in the same household as opposed to 2 or 3 people in the same household. So things like that happen, and that's why these numbers fluctuate so much. They don't fluctuate a lot, but they do fluctuate. Okay. Next question.
Can I take? I have one more.
Okay.
What is the most common resource that is requested through the EOC? And I think we've talked about this a little bit, but honestly, the most common resources are our personal protective equipment.
Masks.
Namely masks, gloves, and most importantly, surgical gowns. And the reason those are most important is obviously to keep our healthcare providers and our EMS providers and our firefighters. It just keeps their midsection, and it basically keeps everything that their uniforms cover protected from COVID-19. So, and they are the most difficult thing to come by statewide and nationally.
Yeah. People have them ordered, and they're waiting and waiting and waiting, and meanwhile they can't work without them. And so the EOC's been great at being able to provide people what they need as a stopgap until those resources actually come in, or we get more. They don't stay long in the EOC, I can tell you that. They come in and they move out.
They are literally flying off the shelves like hotcakes. So, yeah.
Okay.
Well, we're almost at our end of our time, so could you both do a wrap-up statement?
Okay. I guess what I want to say is this is an amazing event. There is so much we don't know, and I know that you hear a lot and don't know what to believe, et cetera, et cetera. So, a couple of things. If you hear it from one person, it's one person. Believe the body of evidence, okay? So that's what science and medicine is about. So you can find an expert to say any one thing and get in front of a theory, but it's really about what repeated observations and investigations and studies show. So the body of evidence is what we need to stick to because that's what's most guaranteed. And right now, We don't have a huge body of evidence, and that's what's so hard. We really don't know. The longer we wait, the longer we put up with this stuff, the stay-home orders and staying away from people, the more we're going to know. And the smarter we're going to be about advising you and taking care of the things that are so frustrating right now, because we have to keep saying we don't know. So, so be patient and understand that a lot of the confusion you have is because we really don't know. And we're going to get there. I know we're going to get there. So deep breath, and if you're having a bad day, get some sunshine, get some fresh air. It is healthy to be outside. I would say the more you're indoors and breathing that air over and over again, it's just kind of it just recirculates germs. So open those windows up on those nice days. Get out on your porch. Just remember your social distancing. Okay.
And I would like to say, obviously, we've said it a few times. We've been at this 8 or 9 weeks now. We've got quite a period to go, but I don't want anybody to focus on that. What I want you to focus on is your family, your friends, the people around you that you may have not met yet, and those are the things that matter the most. Our community is doing a really great job taking care of each other. Our nurses, our first responders, our doctors, basically everybody who's taking care of other humans are doing a wonderful job. And I just would like to say thank you to all of those folks. Thank you to everybody.
All of you.
Yeah,
for doing the right thing.
Yeah.
This will pass.
Absolutely.
This will pass. We will someday be able to look back at this and go, whoa, how did we do that? But we're going to do it.
Yeah, and I am proud to be part of this community, and I thank you all for what you're doing, and I thank you all for what you will be doing, and that's all I have to say about that.
Stay the course.
Can you let them know that will be...
Oh, and
Yeah,
we're
absolutely.
going to do this every week at 3:30 on Thursdays. We'll do another Facebook Live, so join us. Send your questions in, and we'll try our best to answer to the best of our ability. Thanks so much.
Have a great day.